This webinar is about understanding behaviour. Sexual abuse can have psychological, emotional, and physical effects on a survivor, which can feel difficult to cope with. These effects can manifest in different ways and impact on your child's behaviour. It's important to remember that your child is processing their own emotions, and this can be a distressing process. Supporting your child and providing them with space, support, and a listening ear is important. But remember that these things can take a long time, so patience is also important. Your child may struggle with insomnia, nightmares, or night terrors. Memories or pictures of the event unexpectedly popping into the mind. Feeling as if it's actually happening again. Playing or drawing about the event. Not wanting to think or talk about the event. Avoiding anything that will remind them of it. Getting angry or upset more easily. Not being able to concentrate. Being more jumpy and being on the lookout for danger. Being more clingy with parents or carers. Physical complaints such as stomach aches or headaches. Temporarily losing abilities such as feeding, toileting. Problems at school. Lowered self-esteem. Difficulty trusting other people and social withdrawal. It's also normal for children to sometimes regress and behave like a younger child when something frightening has happened. This might look like thumb-sucking, bedwetting, or temper tantrums. If you notice this, then it can be helpful to parent them as you did when they were younger. As they recover, children will be able to move on again and leave these younger behaviours behind. But remember that this may take time. You can help your child by finding words to explain the feelings they have, and let your child know that whatever they're feeling is okay, and their feelings are not right or wrong. Something to remember is to try and make things as normal as possible. People feel safer when they know what to expect, and when something frightening has happened, people can be unsure of what's coming. So you can help your child feel safer sooner by sticking to normal routines as much as possible. It's also important to try and keep boundaries in place that have been in place for all of their lives, such as bedtimes, timings on devices, times with friends. Anything that's an important boundary in your home is important to maintain so as to keep a routine. Be available to talk with your child as and when they are ready. So some parents try to protect their child by avoiding talking about what happened. They worry that they're going to upset their child unnecessarily or make things worse. Some people feel that if they keep quiet, their child will forget about it. Whilst there's an investigation ongoing, it's important that you speak with your police officer to understand what you can and can't discuss with your child. But talking is usually helpful, but things need to be done carefully and sensitively at the right time for your child. But try and provide opportunities, support, and encouragement to help them talk about it when they're ready to, rather than forcing them to. Children may also want to use dolls, toys, or drawings. Something that you can do is have check-in time with your child at the end of the day. So when they're ready in bed, you could have a bit of time where you check in about how they've been that day, how they're feeling, anything they want to talk about. By providing that space as a routine, they know that they've got that check-in time at the end of the day, should they want to talk to you about something, but they're not sure how to bring it up. Something you can also do is to provide a sketchbook and some pens or pencils that they can have on their bedside table, which they can draw and write in, should they have any thoughts or feelings that come up in the night. You can also make an arrangement with your child that you look at that sketchbook either once a day, once a week, whatever works for you and them, if that would be a helpful way for them to communicate with you. The next important thing is to answer your child's questions truthfully. So encourage your child to ask questions. Try to answer them simply and honestly. A child may need to ask the same question several times as a way of coming to terms with what's happened. So it may take a while for them to kind of wrap their head around information and to process information. So to just have patience with them if they ask the same question several times and to help them understand it. And the next point is to help your child to understand what happened. So explain it in a way that helps them to make sense of the main facts and be truthful, but be appropriate for your child's age. So younger children can really benefit from being given a description of what happened. And by having an understanding of what happened, It can help your child to make sense of the events. It can reduce unpleasant feelings such as fear, anger, and sadness. Talking through events can help correct misunderstandings. So children may blame themselves, may think they're at fault for what happened, may be confused about what happened, and you can help to avoid this by being clear and open. It's helpful for children to be prepared so they can talk to others about what happened. So by you being a supportive, understanding, listening ear, it can help them to feel safe and comfortable talking about what happened and how they're feeling. And thinking things through with your child can help your child to realize that although bad things can happen, they don't happen so often that we need to be scared of them all the time. So by being that supportive, listening and understanding person, you can help your child to feel safe.